Hello, this is Dr. Michelle from Living Well with Dr. Michelle. In this video, I'm going to be talking about gut health. You know, this is something that's very personal for me because I've struggled with gut issues since I was a teenager. And I wish I knew then what I'm going to share with you now. We're going to be talking about the most common and most treatable cause of gut health problems and how to feel better and live well again. Before we start talking about correcting gut health, though, let's first talk about who this affects. Did you know the studies show nearly 40% of adults suffer from something called a functional gastrointestinal disorder? The real numbers showed that 49% of women and 37% of men are suffering. That's over 100 million people in the United States. So if this is you, you're not alone. What in the world is a functional gastrointestinal disorder? In simple terms, it's not a tumor or a mass or something wrong in your blood. It's actually a GI problem that is due to something not working right in your gut. So this might include heartburn, acid reflux, and an upset stomach in the top parts of your GI tract. Constipation, bloating, irritable bowel syndrome down in the bottom. Research has also shown that these problems significantly impact quality of life, and I lived it. I could tell you story after story of times that I couldn't eat what everyone else had on the table. Or times when I just gave in. I was just so sick of it, I gave in and I ate it anyway. And then I felt miserable for hours after. Or my favorite, when I ate foods that I thought were just fine and I still felt bad. Talk about frustrating. So I used to joke that my favorite diet was the one where you don't eat anything but water and frozen water, ice, because those are the only foods that were safe. Well, that is not living, and it's certainly not living well. I know, because I lived that way for years. There are a lot of things that impact gut health, but in this video, we're going to discuss the most common and the most treatable causes of gut health problems. We're also going to talk about how to test for it and how to treat it. This is what Living Well with Dr. Michelle is all about, combining information from modern medicine and the wisdom of our grandmothers to find the real answers for problems that we have today. So the first question I hear about gut health is, what causes gut issues? Well, honestly, this is a bit of a loaded question because gut problems can be the result of bacteria, from parasites, from infections, stress, chemicals in food, problems with the water, medications, and on and on. So with so many different possibilities, where do you start? You know, we're just going to start where the food starts. When food gets to the mouth, what does your mouth do? It starts to salivate, right? That saliva has enzymes that start to break down the food. As you swallow, the food travels down the esophagus and past a gate between the esophagus and the stomach. When the food reaches that stomach, it should be full of acid. And the acid does three main things. Number one, it kills the bacteria, the viruses, all the things that might be in our food. Number two, it actually breaks the food apart into absorbable pieces. This is especially important for proteins and vitamin B12. The third thing it does is it ionizes minerals like iron, zinc, calcium, and magnesium so that you can absorb them from the food. Once this acid has done those three things, it then signals. First of all, it signals the gate at the top of the stomach to close up so the acid can't go back up. The esophagus, it's not protected from the acid like the stomach is, so we don't want acid going back up. It also signals the gate at the bottom of the stomach to open up so the food can pass into the small intestines. Now we hear so much about stomach acid and how it's the enemy, right? Isn't that what causes the heartburn and more? You see all those commercials for antacids on TV with someone, clutching their chest in misery because of the acid. Well, no, actually, that acid is what helps you digest and absorb minerals from your food. Without enough stomach acid, you will have more bacteria, viruses, and parasites in your digestive system. You won't digest proteins. Do you have problems, or do you know of anyone who has a problem with gluten in wheat or casein and whey in milk? Well, those are large proteins. That's why there's so many problems. If you don't digest them, your body sees them as an enemy and it will attack. This equals stomach pain with those foods. You won't absorb minerals, and it will show up as bone issues, tooth issues, cavities. That top gate won't close, and the acid goes back up like a boiling lava pool and causing burning. And the bottom gate doesn't open, so the food stays in the stomach too long, fermenting rather than breaking down. Basically, low stomach acid destroys a major part of your ability to digest your food. You don't absorb nutrients as the partially digested molecules can't go through the intestinal wall. They're too big. So now you're protein, mineral, and vitamin deficient, especially vitamin B12. So what do you take if you have heartburn and other digestive issues? Well, those commercials show you should be taking an antacid like Tums. Well, that dilutes the stomach acid. Or a class of drugs called proton pump inhibitors. You know these drugs. Omeprazole is called Prilosec, Nexium, Prevacid. You can get these over the counter. What do? They block and reduce the production of stomach acid. Wait a minute. We just talked about needing that stomach acid, right? And research shows that up to 90% of heartburn and acid reflux is caused by too little stomach acid. So you take an antacid or this drug, they shut off the last bit of acid you're producing, and the problems I just talked about increase. You stop absorbing food. And bonus, if you use these things for a long time, 12 months or longer, you are up to 800 times more likely to develop an intestinal infection like SIBO or C. diff. You increase your chances of developing pneumonia by up to 160%. Bone fractures go up, you're not absorbing minerals, remember, by 300%. And stomach cancer goes up by nearly 250%. These medicines don't fix the root problem, and they lead to serious issues. So what is the real problem? Well, often it's too little stomach acid. You have too little acid, you don't digest food, you ferment, and you have the problems. Well, there's a quick and easy test that you can do at home to evaluate whether you have enough stomach acid. First thing in the morning, you're going to put a 1/4 teaspoon of baking soda in a cup of water. Drink it and see how long it takes you to burp. The burp comes because the baking soda interacts with the acid in the stomach. The more acid, the faster the burp. You should be burping in 2 to 3 minutes. If it takes longer, you most likely have too little stomach acid. So if you do this test and you do have low stomach acid, the first question is always why, and the second question is what do I do about it? First, why? Well, stomach acid is turned off when the body is in stress mode. Think about it. When you have to speak in front of a crowd, or when you are worried about a test, or something's happening with a loved one, your mouth goes dry. This is a natural response to stress. Your stomach also stops making acid. Well, what can push the body into this stress mode? Of course, emotional, mental stress, we know about those, but also infection, often in your mouth, chemicals in the food and water and in your environment, heavy metals, also from the mouth, poor sleep, and more. You know, this is why I talk so much about this problem, because dental infections, heavy metals in fillings and other things in the mouth, and sleep obstructions are some of the leading causes for low stomach acid, and they're all found right here. You know, I know that some things in life can be avoided and others just simply can't. Others are just life. So what do you do about low stomach acid even if you can't change everything that might be causing it? Well, I do have some suggestions, and they actually work. Number 1, remember that protein we talked about. Well, it's important to time when you eat protein in your meal. Introduce protein early on in the meal so the enzymes can get working. The second thing, chew thoroughly. Your mom always told you this and your mom was right. Food proteins need to be broken down to be properly digested. Number 3, time your drinks. Don't drink very much liquid during a meal because it dilutes that stomach acid. So wait until at least 30 minutes after a meal to drink. And be especially careful with alkaline water. Never drink alkaline water along with a meal. Again, it's going to dilute the acid. But do stay hydrated between meals so that things can keep moving. Number 4, you can add betaine hydrochloride with pepsin at mealtime. You're going to find this in a lot of different places. Here's the rule for it. You're going to take the betaine either halfway through the meal or right at the end of the meal. Taking it before a meal sometimes might create something that feels like a heartburn, and it actually turns off the stomach acid production for that meal. So take it in the middle or at the end. When you feel a warmth in your stomach, that's enough. Don't take any more. Don't do this or take this if you're taking ibuprofen, Tylenol, or aspirin. That's the one caution for it. Number 5, you can take digestive enzymes with meals to break down those proteins. Number 6, you can use apple cider vinegar. This is one that a lot of people talk about. You can take up to 1 tablespoon of this vinegar in a bit of water right before the meal. I would start with less and work up to the tablespoon. Number 7, fermented foods. Foods like sauerkraut, kimchi, pickled beets, kombucha, water kefir. They have acids, which are good, enzymes, and probiotics to help with digestion. They're also antimicrobial, and they fight things like H. pylori, which is another enemy of stomach acid. They are great allies in this fight. One caution with fermented foods: if you have mold, candida, or other fungal infections, don't take them without consulting your functional medicine practitioner first. So these recommendations are a great place to start if you have digestive problems. You know, I've worked hard to correct my problems, and while I'm still careful with my diet, I can eat more than water and ice now. If you have questions about gut health, I love to talk about this. Feel free to ask them in the comments section below. If you found this information helpful, please give this video a like, and also make sure to subscribe to our channel for more health and wellness related content, and make sure to tap that bell. Thank you so much for watching. Again, I'm Living Well with Dr. Michelle.